Well, thank you for joining me today, Dr. McGinn. It's great to have you as part of our International Influencers series. Before we get started today, I'll let you introduce yourself.
Thank you, Megan, for inviting me to do this. I'm Lata McGinn, and I'm a clinical psychologist. I'm a professor, a tenured professor at Yeshiva University in the Graduate School of Psychology, where I also direct the CBT training. I'm also co-founder of Cognitive and Behavioral Consultants, which is a clinical training and research center where I also see patients and do research and train students and professionals.
Okay, great. To get us started today, what led to your interest in clinical psychology and cognitive behavioral therapy?
I was always interested in the field, but I first became fascinated by Leon Festinger's work on cognitive dissonance and Martin Seligman's work on attribution theory. And that, led me to the field, but I was not necessarily in clinical psychology. I was completing my master's at American University, where I was headed towards doing a doctorate in experimental psychology. So I was a student in Dr. Tony Riley's lab. And my master's thesis was, the impact of the variable ratio schedule on the development and maintenance of polydipsia in mice. So that was my start. But then three things happened. Well, first, I didn't like mice very much. Second, the wife of my lab mates, who actually loved mice and was extraordinarily comfortable with them. His wife just had completed her postdoc with Tim Beck at the Center for Cognitive Therapy and told me all about her experiences there. And I guess most significantly, it was Diane Chambliss. She arrived at AU and she began her seminal work in agoraphobia. And that was really it for me. I was fascinated by anxiety disorders, exposure therapy, and I just gravitated towards her. And I was actually a therapist on one of her early trials. I remember driving with a panic patient over the bridge. And that was it. And then I applied for my doctorate in clinical psychology, my PhD. So.
Yeah. And who or what had the most important influence on your career?
I guess I've been thinking about that since you sent me the question. I would count Diane Chambliss, Tim Beck, and Bill Sanderson and David Barlow as having the most important sort of influences in shaping and how I developed my career. And I guess in terms of those who have provided me with the most support in my career, I would count Bill Sanderson, Tim Beck, Robert Leahy, and my former dean, Larry Siegel, as providing me with the most support, I would say, in my career.
And what would you consider to be your most important contribution to research and practice in clinical psychology and CBT?
Okay. Well, I would say that my recent work on developing a prevention intervention, where I, developed this intervention utilizing symptom exposure for the prevention of depression, and now I'm adapting it to anxiety. I guess that gives me the most satisfaction and pride. So that was certainly exciting for me to do.
Yes, those are great contributions for sure. How do you think we can do a better job of disseminating CBT to clinicians?
I guess I would say, a few things come to mind. I would say that rather than seeing it as our job to disseminate CBT to clinicians, I think we need to see it as a bi-directional process. Clinicians also have a lot to teach us as researchers, and clinicians, and I'm one of them as well, have a lot to teach researchers. So I think that's one. And two, I think, of course, beyond the work that we're already doing to ensure that we make training in CBT a requirement in graduate school, I think at the same time, we need to offer not just workshops, but like comprehensive training and supervision in CBT outside graduate school. Because at this point, at least, we need to accept that many graduate schools don't have that training, and many professionals are really eager to learn once they're out in the field. And just based on requests to me over the years, I developed a 5-day summer workshop on CBT, which is still going strong almost 10 years later. And that's just a drop in the bucket, And this may not be, I guess, the biggest thing, but I think, I've worked with a lot of DBT colleagues, and I think they've done a very good job in dissemination. And I think sometimes those of us who do more sort of traditional CBT are too busy trying to convince professionals that they should study CBT because it's evidence-based. I think we all know that. I just think that the third wave approaches and third wave CBTs have appealed more to the hearts of professionals and drawn them into studying it, than I would say the more traditional CBT approaches have done. So I think, and I'm sure there are many other things we could do. I could say one more thing comes to mind is that disseminating it to schools, I would say probably would be, as part of our practice, we're in about 100 schools now, which I think gives me great satisfaction because then you're reaching a wider audience.
Yes, schools are an excellent target area for sure for dissemination. And what do you believe to be the biggest challenge facing clinical science now?
I mean, there are so many, but I would say that the biggest challenge is us. I think we need to remain integrated as a field and not divide ourselves up by creating more and more subdivisions and turfs, in the field, counseling versus clinical science versus scientist practitioners versus practitioner scholars. I also think that, that there's a belief among many clinical scientists that we should be the ones developing treatment, but not necessarily conducting therapy, and that we should train students who come to train in PhD programs or to do research. And I think advancing public health by enhancing scientific knowledge in mental health is immense. But there is a tsunami of need out there, and I think we need to roll up our sleeves and work together and sort of respect each other equally. I think our strength really lies in doing both, as one informs the other. And we need to be careful not to have that approach, which can come across as condescension towards clinical work, which I don't think lands very well. So I do think that is a challenge for us as a field. And I've often thought about this, that maybe people who come into psychology are, in a sense, interested in the study of the individual. So perhaps are more likely to think as individuals and not necessarily as, what impacts the team, if you will, what impacts the field, and thinking of it as a group or a public health, And so that's just a thought. I don't have any research support for that premise, but I do think that is an obstacle, So I think we need to sort of get it together and just become more united as a field so that we can approach and kind of make a difference. There's a really huge, immense need out there.
Yeah, that's very important. What recent findings about psychopathology and mental health do you think have the greatest impact on future research and practice?
I mean, that's a hard question. I think what we've done so far has had a tremendous impact, I think, in the field. I think that we've sort of leveled off, I think, as a field in terms of impact, but I think the recent effort to look at mechanisms, I think, will have a major difference. I think will make a major difference in the field. Isolating mechanisms and sort of moving away from brands, I think, would be enormously helpful.
Yeah, that seems to be a very popular and much needed area of research these days. Yeah, sure. What changes would you want to see in graduate teaching and training in psychology?
Wow, if I could really dream, I would say my dream would be for psychologists to be united under one degree only, and have research training, clinical training in disseminating CBT to professionals, schools, agencies, and training in advocacy in CBT, making all of that part of the curriculum so that we can be united and have the option to make a difference in whichever field we want to meet those needs that we talked about, right? They're vast out there, and also to work to get it reimbursed at the same time, because we're not so much. And that's another thing I learned a while back, that psychologists don't go into advocacy as much as other disciplines. And that is very surprising to me.
Definitely. Along those lines, do you have any advice for graduate students and trainees who are interested in CBT?
Yeah, I would say make sure you do your research and go to a program that trains you to be a CBT researcher if you want to be a researcher when you finish. And then go to a program that actually provides comprehensive clinical training in CBT if you want to be a clinician when you finish. And that way you don't have to do it after you finish graduate school.
Great advice. How do you see CBT evolving in the next 10 years?
I mean, I see us, and I see CBT partnering more with medicine, psychiatry, I think, which can be a very good thing on the one hand. I think it allows CBT to be offered during routine care, offers, wellness services, having it be more destigmatized. I just think we need to be very cautious about not steering CBT towards area just because it's funded today, so that we can really value our specialization and expertise in behavioral approaches to see where that can take us.
And last question for you. What areas or issues do you feel CBT needs to address more in the future?
I think we've done an excellent job in applying CBT to so many areas and conditions. What I do think we need to move is really towards prevention and disseminating principles of CBT in schools, businesses, counseling centers, and agencies, including the government, so that we can make a substantive difference. I think offering CBT in mental health practices, of course, continues to be important, but to make really a public health impact. I mean, I also think we need to work towards debranding, and that way we can scale up dissemination so that we can take the components of what works, right, without worrying about brands, and work with agencies. I remember hearing, actually, it was at ABCT, there was a panel of people who were from the CDC. And it was so staggering to hear them say that one of the reasons they haven't been able to disseminate what works is because they can't get past the brands, And so that was striking to me. So I think sort of working with agencies such as the CDC and the WHO to be able to make a public health impact across the globe would be so key, during peace, war, other world crises. One of the things that I worked with colleagues was I founded with colleagues the World Confederation of CBT, which, my dream was for it to become this sort of humanitarian organization and become the vehicle through which CBT can do all this. We sort of drew in regional members of regional organizations. So the European Association is a member, ABCT is a member in North America. The Australian Association is a member, Latin American, Asia. So they've all come within this umbrella of the World Confederation. And now it's our time to really make a difference and link to agencies like the United Nations, the WHO, and sort of make a difference and have that become the vehicle through which we can make a larger difference.
Yes, I love that. And I think that's a great summary of just why we invited you to speak as an international influencer about all the things that you're doing in the field and your perspective on the future of CBT. So thank you so much for being with us today. I really appreciate getting to hear about your very impressive career and your thoughts on the field.
Well, thank you, Megan. I appreciate being invited.
Thank you.
Okay, bye-bye.
Bye.